Cancer. This word is enough to turn your whole world upside down. Cervical cancer might not be the most common cancer affecting women, but it has pretty serious after effects. It's physically and mentally traumatic for people suffering from cancer as well as their families. But you might be able to prevent the ordeal if you're aware of the early signs and symptoms. In today's video, let's discuss the important things that every woman should know about cervical cancer. Is it completely preventable? Does regular screening help? We're discussing all that and more. But first, what exactly is cervical cancer? The cervix is the connection between the birth canal and the uterus. The uterus is a sac in which the fetus grows. The lower part of the uterus terminates into the cervix. It might look like a donut and is covered with layers of cells. The cervix again has two parts. The one closer to the uterus is called the endocervix, and the exocervix is the part that your doctor would usually be able to see with specialized devices. It is the extreme end of your cervix. The endocervix and exocervix meet in a band called the transformation zone. This is where the cervix cells start becoming abnormal in the early stages of cancer. But any change in these cells is not always cancer. The cells of the transformation zone change their shape after childbirth or as you age. Changes from a healthy to a diseased cell are not rapid, it's gradual. Before converting to full-blown cancer, there is always a precancerous change. What's surprising is that in most women, the precancerous cells are not converted into true cancer. That being said, more than 600,000 women around the globe suffer from invasive cervical cancer. It affects around 14,000 people in the United States alone and claims about 4,000 lives per year. The statistics show that cervical cancer is less risky when compared to other life-threatening cancers like lung cancer. Research is aiming to reduce this rate even further and save lives. That can happen only if you pay keen attention to your body. Interested in knowing the symptoms of cervical cancer? The early stages of cervical cancer are pretty symptom-free, so much so that you might not even feel any pain or discomfort. It's not possible to feel cancer growth with your fingers, but if you come across a bump in your vaginal passage, make sure you visit your gynecologist. You could have a tiny cyst or polyp completely unrelated to cervical cancer. It's only when cancer starts spreading to the adjacent organs that you might experience painful symptoms. It may begin as general fatigue, tiredness, and abdominal or pelvic pain. If you experience bleeding or watery discharge with or without a foul smell, it could be an alarming sign of cervical cancer. Heavy bleeding in between menstrual periods, active bleeding after intercourse, vaginal bleeding after menopause, or heavier and longer menstrual periods could be a red flag of cervical cancer. Having one or many of these symptoms does not necessarily mean it's definitely cervical cancer. As cancer advances, symptoms like diarrhea, difficulty urinating, passing stool, blood-stained urine or stool start appearing. Mild backache with inflammation and swelling in your legs can also be seen. These may seem like trivial signs, but they literally could be life-saving. This is why it's important to be vigilant to pick up any of the clues at the right time. What causes cervical cancer? Most cancers of the body occur from damage to the DNA, but almost 99% of cervical cancers are caused by the human papillomavirus, or HPV. It is a group of viruses that has more than 100 varieties. It can cause viral infections, tiny warts, and cancer in various parts of your body. It can cause oral, penile, head and neck, vaginal, vulva, and anal cancer in humans. Studies show that HPV-16 and HPV-18 are the root cause of a major percentage of cervical cancers. These viruses do not require blood or saliva to get transferred from person to person. Skin-to-skin contact during intercourse with an infected partner is enough for anyone to get affected by HPV. A cut, wound, or small abrasion is enough for this virus to gain entry into your body. It slowly starts weakening your immune system. HPV can not only affect women but also affects the genital areas of men. HPV infection may take as long as 15 to 20 years to develop into cervical cancer. There is much that you can do in this time and become cancer-free. Can cervical cancer be prevented? Your doctor will screen you to find out whether you have cervical cancer. Regular screening can help to prevent you from developing cervical cancer as there are no stark signs of early changes. Early detection can put an end to its seriousness. 3 broad categories of screening can detect cervical cancer. First is the Pap test. It detects abnormal and irregular cells in the cervix. Your doctor will use a speculum to open up the vagina. A swab or a brush is then used to scrape cervical cells. The cells are collected in a liquid and sent to the laboratory for examination. The second test used is the HPV test. It detects the presence of human papillomavirus that could most likely cause cervical cancer. These are not painful procedures and are well tolerated by the patients without anesthesia. The third form of screening is a biopsy. Generally, a punch biopsy is enough to take a sample of the tissue to confirm cancer. Other tests like liver function, kidney function, urine tests, and scans of the bladder, rectum, and abdominal cavity can be done to determine the spread of cancer to adjacent organs. Women above 21 to 65 years of age can get screened by either of these methods. From 21 to 29 years of age, women can get a Pap smear done. From 30 to 65 years of age, they can get an HPV test with or without the Pap test. Remember to take a repeat test every 5 years if you go for the HPV test. When you're in your 20s, get a Pap smear every 3 years. If you're opting for combined tests, then repeat every 5 years. A positive Pap smear or HPV test does not mean you have cancer. It means something is going on, and before it progresses to cervical cancer, you should actively intervene. Vaccines have played a crucial role in everyone's life for the past couple of years. They guard you against something as trivial as a cold to COVID-19. Turns out vaccines can be important for protecting you from cervical cancer too. Apart from the screening, the Gardasil vaccine has shown 97% efficacy in preventing cervical, vulvar, and vaginal cancer. It can also protect against high-risk HPV strains. There is another FDA-approved vaccine called Cervarix that's also effective in eradicating HPV 16 and 18. The current medical guidelines recommend girls and boys as young as 9 to 26 years get vaccinated with either of these vaccines. Another positive thing that helps deal with HPV is progestin-based intrauterine devices. Studies have shown this contraceptive method reduces the risk of precancerous cervical lesions and cervical cancer. This is not a medicine or a vaccine, but can positively help the condition. Did you know a few people could be at higher risk of getting cervical cancer? Women who are chronic smokers have compromised immunity, so when they get infected by HPV, their body's natural mechanism cannot fight it off, causing the virus to stay and multiply. Studies have shown cigarettes and chronic tobacco smoking put you at greater risk of cervical cancer. People with HIV also have a higher risk than average chance of developing cervical cancer since their immune responses are compromised. Limiting the number of sexual partners and practicing safe sex can keep you away from this virus in the first place. Remember to get a regular pelvic examination if you are sexually active. Prolonged use of oral contraceptive pills can also be a leading cause of cervical cancer. Remember to have them under the supervision of your doctor only. Additionally, women having more than 3 full-term pregnancies are in the high-risk group of developing cervical cancer. As science advances, researchers study the side effects of older drugs. It turns out that women who consumed a hormonal drug called DES transferred some compounds to their female children that put them at a higher risk of developing cervical cancer. If your mother took this drug between 1938 to 1971, you might want to get yourself checked. Considering the side effects of this drug, it is no longer prescribed by gynecologists. But there's no need to be scared of this cancer. The prognosis of cervical cancer is good, and your chances of being cancer-free are better than in other cancers. It'll all depend on what stage the cancer is in. Doctors assign stages to your cancer depending on the results of the testing. Stage 1 is the easiest to deal with, and Stage 4 is the most complicated. Coming to the treatment part, did you know cervical cancer can be detected mid-pregnancy? Human papillomavirus may affect the growing fetus and affect its voice box. A team of gynecologic oncologists decides the treatment based on your age, general fitness, and whether or not you want kids in the future. A few methods like laser, cryosurgery, immunotherapy, chemotherapy, and biopsy may not affect your fertility. But if cancer has spread to other parts, then a hysterectomy or complete removal of the uterus can affect your family planning. Hormones are the tiny chemical messengers in your body that help all your systems. Since women are undergoing constant hormonal changes, it's crucial to maintain their healthy balance. They can bring you a pile of disorders when they're out of whack. Want to know more? Then watch 9 symptoms of hormonal imbalance in women, or 13 warning signs your body is producing too much estrogen. Go ahead, click one, or better yet watch both and learn more about how to keep your hormones in check. Do you go for regular checkups? Let us know in the comments below.